Generally, when we first diagnose a seizure, there's a few indications we have to start a long-term anti-epileptic. So if a patient presents to us in status epilepticus, which is a continuous seizure that lasts and lasts and lasts until we have a medical intervention, like an IV benzodiazepine or drug or something like that, or the frequency of seizures. So if they're having clusters, which is more than 1 or 2 seizures in a 24-hour period, or if we're having several seizures in a period of, say, 3 to 4 months. Really, those are indications to say we should start medications to help control those seizures so we can prevent the seizure disorder becoming more rampant or more affecting the patient more frequently later on in life. And as I mentioned, there's a lot of drugs that we can use to control those seizures. And generally, when we start a long-term oral anti-epileptic drug, because of one of the indications that we talked about, that's generally something that they're going to be on for the rest of their life. There's a few exceptions to the rule. If we're treating a disease process that we can correct, an example might be a portovascular anomaly, a liver shunt. That is something that we can occasionally surgically correct, and so they're sometimes on anti-epileptics. It's recommended now that they start it before surgery and then it be tapered off over a period of time. And doses of medications and what medications that an animal is on certainly can change over the course of their life, but generally if we have diagnosed something like epilepsy or symptomatic seizures, that we're going to have that animal on those medications for the rest of its life.